Steve, same question to you. First off, why? I mean, the VA, it seems like there's been, correct me if I'm wrong, but 3 different directors in the last 4 years. It doesn't seem to matter who we have in there. But why does it seem to be plagued with so many issues? I mean, is privatization maybe the answer here? I know Shulkin's arguing against it.
I think that's the big question. Why are there so many issues? And this happens when you have these enormous, monstrous bureaucracies. That's why Americans are fundamentally opposed to big government. Why wouldn't we be opposed to this massive bureaucracy? It's a sad state of affairs when an illegal alien come into the country and get medical coverage and medical health care quicker and easier than a veteran. That's a huge issue. So I think looking at privatizing portions of the VA is a good idea. We should be looking at new ways of doing business because obviously this system's not working. And I think we should be giving Admiral Jackson a chance to perhaps show his leadership and put a true team together. The outgoing VA secretary did not do that job.
Yeah. Well, and talking about this team, I mean, he does have a big job ahead of him.
Exactly. Now, I don't want people in the view to confuse with the word privatization. I'm not talking about privatizing the entire VA. What we're talking about is if you're a veteran and you've been waiting to see a doctor or to get a colonoscopy for 6 months, you go to a family doctor or to the hospital, private hospital, and the government will reimburse that doctor or that hospital. That's my concept. It's called Veterans Choice. That's my concept of privatization.
Yeah.
It's not privatizing the entire operation. So I think.
And is that? I mean,
Miranda,
go ahead, Steve.
I think look, Miranda. You want to bring competition into any marketplace, and this is a huge market. The market for taking care of veterans' health needs is a gigantic market. Let's bring elements of competition. I don't think anyone is saying, not even the president, that you privatize the entire VA. I think what he's saying is, I know he is, in fact, bringing in competitive elements that can drive down costs, increase services, bring better services, to these men and women. Again, I'm going to go back to my earlier statement. An illegal alien comes into this country and gets health coverage faster and better than a veteran in most cases. And where are they going? Most likely government-subsidized private enterprises where the taxpayer is paying for their health care bills. So we need sweeping changes, and what the outgoing VA director did with his expenditures is absurd. It indicates poor judgment, and I think the president recognizes that. He's also looking at measurables. And when I say measurables, as a CEO, as a man who ran a business, you look at performance, and the performance just hasn't been good enough.